Thank you, Cahirla. Minister, good mental health provides a fundamental basis for overall good physical health. The two are intrinsically linked and cannot be delivered without the other. However, this government has shown it feels differently, recently diverting €12 million funding supposedly ring-fenced for mental health services over to its bigger sister in the Health and Health. It is 10 years ago this year that a Vision for Change was published, yet unsurprisingly, in all that time it has never been fully implemented. This government and previous government claims budgetary constraints for the reason behind this failure, but everyone knows it was complacency and a lack of political will that led to this vision and left this vision an unrealised ambition. For the second time this year, mental health funding has been unfairly targeted. While other areas of the health service receive additional funds to deal with pressures, mental health did not. It's incredible that the Minister feels there was spare capacity within mental health services to use his funds to take care of other overruns in other parts of the health service. Mental health reserves do not exist to prop up the bigger health sister. It should be seen as a standalone, independent entity within the Department of Health. The extra €35 million was ring-fenced to improve prevention and early intervention counselling services for those under 18 years of age, dual diagnosis of mental health and substance abuse, services for psychiatry for later life and those with mental illness and or intellectual disability, and for the development of perinatal mental health services. This government made a commitment in the 2011 programme for government to dedicate €35 million in ring-fenced funding towards the development of community mental health services. On this you have reneged on your promises too. How many times over the last 5 years have we seen that this funding was not in fact ring-fenced but was diverted to other parts of the health services? The Mental Health Commission has recently expressed concerns in the staffing of community mental health teams, indicating there are still large gaps in teams, especially in relation to social workers, occupational therapists, nurses and psychologists. We are still only at 75% of the required staffing as recommended in the National Mental Health Policy of a Vision for Change. Some areas of the mental health services have been largely ignored, including mental health of homeless people, of people with intellectual disability and maternal mental health services. It's a sure sign of dysfunction if other areas of health, such as primary care, disability and acute hospitals, get funding for extra pressures, while mental health services do not. I want to focus on two particular areas of mental health services, for children and for LGBT people. In relation to mental health services for children, the Children's Rights Alliance recently allocated a D grade in its 2016 report card for the government's work in the area of children's mental health. According to their research, we are currently experiencing a crisis in operational beds for child and adolescent mental health services and a crisis in staffing level in CAMHS teams. The Children's Rights Alliance indicated that of the 129 specialist teams needed for CAMHS to operate effectively, only 63 teams are in operation. And as of November last year, the number of clinical staff in CAMHS posts was 505, representing only half of the staffing level recommended. Without dedicated CAMHS beds and CAMHS teams, children end up in acute psychiatric units or in paediatric wards of general hospitals, and the number of children and young people placed in adult inpatient units remains high. We also need to focus on particular communities vulnerable to mental health issues. In this case, I want to mention specifically LGBT young people. As indicated in the 2012 report on youth mental health by Headstrong, young LGBT individuals are twice as likely to self-harm and to suffer from mental health issues as other people. The report also found a strong correlation between bullying and mental health problems. Within the report's recommendations, reducing mental health risks and building resilience is a central ingredient to addressing mental health difficulties for people coming out. But this means investing in youth work which organisations like Belong To have been doing in the past decade. Youth work helps build resilience in LGBT people and therefore better mental health. Resilience can also be learned through our school system and through the Stand Up campaign carried out by Belong To, which is in 25% of post-primary schools. However, programmes like this need more investment to be able to address the full scale of homophobia and to reach more schools across the country. Funding needs to be secured within the HSE and the Department of Health, and most importantly, the political cycle needs to be taken out of funding allocations and planning. To conclude, I would like to remind the House that today there remains no legislative entitlement to health care or mental health treatment in Ireland, and that children and adolescents have a right to enjoy the highest attainable standard of physical and mental health under Article 24 of the UN Convention on the Rights of the Child.
Thank you, Deputy.
And also under Article 12 of the International Covenant of Economic, Social and Cultural Rights. And we should be enshrining those rights in our Constitution to ensure that people can access the services that they require in the future.
Thank you, Deputy Pringle.